Hi everyone, I'm Kara Sundlin with Parents TV. When it comes time to have children, there are many couples who unfortunately are going to figure out it's much harder than they ever dreamed of. As many as 1 out of every 6 couples will experience infertility. The good news is there are many options and experts to help you conceive. When you meet Lisa Glowacki and her 2 children, Nicholas and Caroline, you would never know all she went through to become a mom.
It was probably 9 months of trying before we decided to get some help.
She was 38, her husband 39, and they knew the clock was ticking. She went through numerous procedures, including 4 cycles of in vitro fertilization, before doctors said her chances of conceiving were less than 5%.
And we just weren't ready to give up. Neither of us are the kind of person that gives up without a fight, and we just decided to go for it, and now I have a little son.
Nicholas is almost 2 now, and now he has a baby sister named Caroline, who's 3 months old. Both miracle children conceived with science.
I think the major reason you're seeing that is not because infertility is more common or more prevalent, but it's because people, for whatever reason, their careers or whatever, have postponed having children. Infertility is defined as a couple who's been trying to actively conceive with appropriate mid-cycle timed intercourse for about 1 year's period of time.
After you've given nature a shot, doctors will investigate your medical history and run some tests.
When you look at couples with infertility, about 40% of the time it's due to a female factor, about 40% of the time it's due to a male factor, 5% of the time you'll find both, and then a large percentage, 15 to 20%, it's unexplained.
Ultrasounds are often used to look at a woman's reproductive organs. Men have to give a sample. So after the man gives a sample, it ends up here. And you actually count the number of sperm, right?
We do.
Okay. So
this is how you count.
They use this machine to keep track.
So we count modal, barely modal, just twitching, and then we also count, and then I slide a finger over, and that's actually non-modal.
The collected sperm are frozen in here. Did you know the average man produces 50 to 150 million sperm each time? But sometimes the sperm needs some help getting to the egg.
The vast majority of sperm doesn't make it up into the upper reproductive tract.
The cost can be under $500. For the woman, it's no more invasive than a pap smear. If more needs to be done, in vitro fertilization is the next option.
The first thing we do is we stimulate the female with injectable fertility medications. And she takes those medications for about 8 to 10 to 12 consecutive days. So she's doing a once or twice a day injection. It's a very simple process.
Dr. Nolson says that part is painless. Then
we take a little needle that goes through the vaginal wall, and we go into each ovary, and we aspirate out the eggs from each ovary. That process takes 10 to 15 minutes. The patient stays with us 45 minutes to an hour afterward, just until the anesthesia wears off.
The eggs and sperm are mixed together to create embryos, and a few days later, those embryos are implanted.
Because with IVF you have precise control in terms of how many embryos you transfer back, having a birth in excess of twins is relatively uncommon.
Success depends a lot on your age.
In our program here at the center, in someone who's 30, 32 years of age, her success rate's 50 to 55%. By the time you reach 40, that's down to around 35%. By the time you reach 43, you're at best 10 to 15% or less.
And it's expensive. How much?
A cycle of IVF is somewhere in the neighborhood of $15,000 to $20,000.
Fortunately, as a teacher, Lisa's insurance paid for everything, but emotionally, she felt spent.
It definitely is a test on your marriage. You know, I mean, we started dealing with this when we were newlyweds, and then we had 2 pregnancies and a miscarriage and 7 IVF cycles, all within 3 years.
Then the moment they were born, Nicholas and Caroline made all the agony disappear.
Yeah, for anybody that's going through it, it's so worth it.
In addition to traditional fertility treatments, you can also explore the mind-body connection for having a baby.
Doreen Fishman is a registered holistic nurse, and she's spent decades using energy therapy to heal people.
We do know that the more that you want something, if you're going after it with the intention of a lot of stress behind it, it just seems to hold the process back from occurring. But when you actually do it in a more relaxed state, we found that you have better results.
15% of infertility is unexplained, meaning doctors can't find a physical problem.
So is there the belief that that actually may be just on an energy level, a blockage somewhere?
Oh, sure, sure.
And even if there is a physical reason for the infertility, doctors at the University of Connecticut often recommend different types of energy therapy to help women respond better to in vitro fertilization.
Sometimes it's just aiding the person to be able to endure going through their procedure they need to go through.
She uses touch to rebalance energy and teaches her patients how to breathe away stress.
Anyway, I would say take a breath, really, and then always when I'm asking you to take that breath, you're breathing in deeply, very nicely done, and then exhaling out and just letting go of that stress and relax. Energetically, what I'll find with people is that probably more times than not when I'm working with them is that they'll disclose something that they've been feeling or holding on to that they have about becoming pregnant. Maybe it's a fear base, to it.
For energy therapy to work, you have to be willing to practice the relaxation techniques in your daily life. The things you learn will certainly serve you well when you do conceive.
Once you have the baby, boy, you'd love to have those, relaxation techniques.
If you're experiencing difficulty getting pregnant, the best thing to do is seek the advice of an expert in the field of fertility. There are many options out there to help you have your baby. Thanks for watching Parents TV, your source for the best information for your growing family. I'm Kara Sundlin.
Thank you for watching Parents TV, our families, our lives.